Hello everyone, welcome to sqadia.com, and in our third section of lecture topic genitourinary problem, we will talk about cervicitis and pelvic inflammatory diseases. Cervicitis is the inflammation of the cervix of the uterus. In this section, we will talk about gonorrhea, chlamydia, and pelvic inflammatory disease. Gonorrhea is caused by Neisseria gonorrhoeae. So it's the causative organ is Neisseria gonorrhoeae, and symptoms usually there is vaginal discharge and lower abdominal pain is common. Infections are very common in gonorrhea, and usually the infections depends on the sexual contact site, which leads to different infections in different areas. So rectal infection is common after the anal intercourse. Endocervical infection is common in the normal vaginal intercourses, and then pharyngeal infections are common after the oral intercourse or oral sex. This is pharyngeal infection is usually asymptomatic. No symptoms are present, but oral sex can lead to pharyngeal infections. Then ophthalmic infections are common in patients with gonorrhea after the eyes are touched with the secretions. Usually they can lead to infections of different infections, like uveitis is very common, which is the infection of the uveal tract in which choroid and ciliary bodies are infected. And neonatal infections are also common if the mother has gonorrhea during the pregnancy. They can spread the infection to the newborn. And in the newborn, usually the eyes are very commonly infected, again, which leads to uveitis or neonatal infections or other neurological infections also occur. The gonorrhea is diagnosed by the nucleic acid amplification testing, and it is effectively treated by third generation cephalosporins and azithromycin. Then the other infection is chlamydia. Chlamydia is also caused by Chlamydia trachomatis. It's a very, very common infection, common bacterial infection. One of the most common bacterial infection. It also involves other sites like gonorrhea, and NAT test is used for diagnosis. Chlamydia is also treated by azithromycin or doxycycline. So it is caused by Chlamydia trachomatis. Infections occur in like the gonorrhea. It also causes rectal infections, pharyngeal infections, and vulvovaginal infections. Then pelvic inflammatory disease. Pelvic inflammatory disease is the inflammation of the pelvis, pelvic organs, which include the fallopian tube, uterus, ovaries, and this leads to scarring and adhesion formation. Usually the bacteria, besides the chlamydia and gonorrhea, that also cause pelvic inflammatory disease. The other bacteria that cause this is Mycoplasma genitalium. So gonorrhea, chlamydia, Mycoplasma genitalium all can lead to pelvic inflammatory diseases. And this usually occur by the ascending infection. Ascending infection means infection that goes from the vulva and vagina and goes up into the uterine cavity, and fallopian tubes. The symptoms of pelvic inflammatory disease are there is bilateral on both sides abdominal pain, dyspareunia. Dyspareunia is along with vaginal discharge. Dyspareunia means painful intercourse. Usually the female, they complain that they have very bad pain during the sexual intercourse. Then there is intermittent menstrual bleeding. Patients with pelvic inflammatory disease complain intermittent menstrual bleeding. They have off and on spotting or bleeding in between the regular menstrual cycles. And PCB means postcoital bleeding. So they have bleeding after the sexual intercourse. So these are some very common symptoms of pelvic inflammatory disease in which patient complains that she has abdominal pain, they have intermittent menstrual bleeding, they have dyspareunia or pain during the sexual intercourse. Clinical findings when the patient is examined, there is usually tenderness. When the doctor put the hand on the lower abdomen and press it, patient feels pain. So that's the tenderness in the lower abdomen. Usually when the cervix is moved, patient feel the pain. So cervical motion tenderness is also present. And there is infection and inflammation of the cervix. That's also very common. Diagnosis is by laparoscopy. Laparoscopy is this procedure in which the laparoscope is the equipment which is inserted into the abdomen through small opening, and doctor can directly see inside the abdomen and find out what is the problem inside the abdomen. So laparoscopy. Treatment for pelvic inflammatory disease include macrolide or tetracycline and also metronidazole with third generation cephalosporins. So this was about the pelvic inflammatory disease. So in the third section, we talked about diseases that cause infections in the female reproductive system and that cause cervicitis. And we talked about gonorrhea, chlamydia, and pelvic inflammatory disease. Thank you for watching sqadia.com.